Hey there, I'm Mike with the Annuity Expert. Today we're going over a common question that we get, and that's, what is everything you need to know about signing up for Medicare? Medicare has four main parts. Part A, also known as hospital insurance, covers inpatient hospital care, skilled nursing, hospice, and some home health services. Most people qualify for premium-free Part A based on their work history. Part B, or medical insurance, covers doctor visits, outpatient care, preventive services, and medical supplies. It requires a monthly premium, and delaying enrollment could result in penalties. Part C, or Medicare Advantage, bundles Parts A and B through private insurance companies and often includes Part D for prescription drug coverage. These plans may also offer additional benefits like vision, dental, or hearing coverage. Lastly, Part D is prescription drug coverage, which helps with prescription medication costs. Keep in mind that penalties can apply if you delay enrollment without other credible drug coverage. If you're turning 65, your initial enrollment period, IEP, is the time to enroll. It begins 3 months before your birthday, includes your birthday month, and ends 3 months after. A 7-month window to sign up for Medicare without penalties. If you're already receiving Social Security benefits, you'll be automatically enrolled in Parts A and B. If you're still working or have employer coverage, you may qualify to delay Parts B and D enrollment without penalty. Before we jump back into the video, let us introduce you to the Annuity Expert, your trusted resource for financial guidance. At the Annuity Expert, we provide tools, insights, and expert advice to help you make confident financial decisions and achieve your goals. Our learning labs are designed to simplify complex topics like annuities, insurance, and retirement planning. With expert guides, personal finance tips, and product reviews, you'll find everything you need to build a stable and secure financial future. If you're looking to grow your savings, check out today's interest rates. You can shop and compare the latest rates to find the best opportunities for your financial needs. We also offer a suite of free financial calculators designed to help you plan smarter and achieve your goals. From retirement and investing to insurance, our tools cover a wide range of financial needs. Whether you're estimating retirement income, projecting savings growth, or evaluating insurance options, these calculators empower you to take control of your financial future with confidence. For personalized advice, speak with our licensed financial professionals for free. Share your goals, concerns, and unique circumstances, and together we'll craft a plan tailored to your needs. Visit the Annuity Expert today and start taking steps toward the financial future you deserve. Choosing the right Medicare plan depends on your specific needs. Consider factors like your preferred doctors and hospitals, any prescription medications you take, additional benefits like dental or vision, and whether you plan to travel frequently. Tools like the Medicare Plan Finder and resources like the State Health Insurance Assistance Program SHIP provide free, unbiased advice to help you make informed decisions. There are important enrollment deadlines to keep in mind. If you miss your initial enrollment period, you can enroll during the General Enrollment Period, GEP, from January 1st to March 31st each year, with coverage beginning on July 1st. For Medicare Advantage and Part D, the Annual Enrollment Period, AEP, runs from October 15th to December 7th, with changes taking effect on January 1st. When it comes to costs, while Part A is often premium-free, Parts B, C, and D come with premiums, deductibles, and potential copayments. Higher income beneficiaries may also pay an additional premium called the Income-Related Monthly Adjustment Amount, IRMAA. If you're looking to save, programs like Extra Help or Medicare Savings Programs might assist with costs. Additionally, Medicare covers many preventive services for free, such as flu shots, mammograms, and annual wellness visits. Enrolling in Medicare is a big step, but with the right information and support, you can make confident decisions about your healthcare. So, if you want to learn more, don't hesitate to reach out. You can visit us online at the Annuity Expert or call us to schedule a free consultation at 770-755-1565. Again, that's 770-755-1565. Also, if you want more tips on your retirement, like and subscribe. Remember, it's never too early to start planning for your future.